Hello.
Come on, boy.
Okay. Hello. Good afternoon to all. Good afternoon. Good afternoon. Rakesh sir, good afternoon.
Sir, good afternoon, sir.
Good afternoon, sir.
So, are we waiting for the guest or sir has arrived?
Yes, sir, he is there.
Good afternoon, Dr. Denzy. Sir you've made sir the host? Yeah.
Yeah, I think now
Yeah.
should be fine. Yeah, are you able to hear me?
Yes. We can hear you. We can hear you.
Okay, excellent. All right.
Good afternoon.
Okay. Good afternoon, everyone.
So very nice to have you among us, and we're really happy that a doctor can spare some time and talk to our students. And end of the day, what matters is how people in the profession motivate the younger generation. So of course we have a few events before we start, so I'll allow the host to start, but of course we'll be conversing with each other during the session. Princy ma'am, please start.
Someone. Monisha, kindly.
Yes, ma'am. Education is the most powerful weapon you can use to change the world, said Nelson Mandela. Good afternoon to one and all present here. I am Monisha from second year science. I call upon Dr. Deepa ma'am, HOD of Science Department, to welcome the gathering.
Good afternoon. I extend a warm welcome to all for today's webinar on the topic Building a Career in Dentistry. I would like to welcome our beloved Principal Sir, Dr. Vinay Ranganathan, who have organized this wonderful webinar. I am glad to welcome our Honorable Chief Guest, Dr. Denzy Lawrence, for today's session, and also welcome my dear lecturers and my dear students. Dental problems are commonly encountered in most of the people nowadays. I kindly request Doctor to enlighten us through his webinar. I thank you.
Thank you, ma'am. Now I request Hemavati from 2C to speak about Charan.
A very good afternoon to Principal Sir, Academic Head Kathy Ma'am, respected lecturer, and my dear friends.
A little bit volume you need to increase. Speak closer to the mic. I need you to hold it. Slightly volume you need to increase.
I'm Hemavati, studying second PUC here at Charan's PU College, and I'm here to speak a few words about our college. Charan's PU College was started in the year 2013 under the able leadership of our principal, Dr. Vinay Ranganathan Sir, who returned from the UK in order to start a college where the voice and opinions of every student could be heard, valued, and respected. Dr. Vinay Sir has completed his MS in the area of nanotechnology, specializing in quantum physics and carbon nanotubes. Sir further went on to strengthen his business acumen with an MPHIL at the University of Cambridge, UK and MIT in the US. His PhD was focused in the area of transformational leadership in education, where Sir has written several papers in the key research journals. After working for several years as a professor and a research scientist at the University of Cambridge, our principal returned to serve our country and help lower and middle class students dream big in life and achieve something which their parents could have never dreamed of. Every student who is given admission at Charan's is personally selected by an interview process by Sir, and there is no system of cutoff percentage, hence giving a chance for students who have not performed in the SSLC to shine once more here at Charan's. We then have a one-to-one interaction with all the lecturers, which makes us feel comfortable and become friends with them even before the classes start. Honesty, humility, and discipline are the important pillars of Charan's, and we Charanites are taught how to maintain the balance between studies and extracurricular activities. Our chairman sir is also always smiling and keeps motivating us with various interesting stories and activities. At Charan's, classes are conducted in interesting ways, not only with presentations and projects, but also debates, charts, group discussions, role plays, and theatre visits. We are given regular tests so that parents are aware of our progress and can approach the lecturers immediately if we are weak in any subject. Our principal sir personally mentors the progress of every student and talks to them personally to understand which subject they are weak in and how to rectify their problem. At Charan's, we are allotted personal mentors with whom we can share any problems in academics or personal life which we may face during our college days. Our lecturers and mentors also help us tremendously at every point of time, and they take great care that new students should not face any difficulties during their new journey. We had one of the biggest inter-college fest blaze, where all the college exhibit a wide range of talents right from debate, rangoli, mehendi, face painting, college, gaming, nail art, skit dance, mad ads, and fashion show. Online cannot keep us apart in pandemic, it only brings us together. We also have online attitude fest with various events like cookery, face painting, mask making, singing with karaoke, style your mom, Instagram reels, and mehendi. Also, we have inter college fest attitude where all the students are given opportunities to come out with their personal skills and talents. With the start of Charan's Premier League since 2017 year, Charan's has become famous for conducting the most prestigious inter-school and inter-college cricket tournament (CPL), and students from various schools and colleges come to fight for the name and the coveted cup. Last year, around 10 schools, 5 colleges were finalized for CPL. We the Charanites were the winners of 2019 CPL. We also have various sport tournaments, including football tournaments, kabaddi, throwball, kho and various other athletic events where students participate with full enthusiasm and excel. Our principal sir conducts regular seminars in online on various career opportunities like animation, hospitality, photography, fashion, computer design, aviation, chartered accountancy, etc., enabling us to expand our horizon and dream of new career opportunities. Our days are also filled with various motivating reminders from eminent personalities, and you as Charanites will enjoy college life to the fullest. Thank you and have a great program ahead.
Thank you, Hema. I call upon Prajan Raj from 2C to briefly enlighten us about dentistry.
A warm welcome to one and all present here. Myself, Prajan Raj from 2nd PUC. I have come before to speak a short note on dentistry. A dentist, also known as a dental surgeon, is a medical professional who specializes in dentistry, the diagnosis, prevention, and treatment of diseases and condition of the oral cavity. The dentist supporting team aids in providing oral health services. The dental team includes dental assistants, dental hygienists, dental technicians, and sometimes dental therapists. In dentistry, there are various branches like endodontics, orthodontics, minimal intervention dentistry, prosthodontics, pediatric dentistry, periodontics, oral and maxillofacial surgery, oral pathology, and oral medicine. Pierre Fauchard of France is often referred as the father of modern dentistry for being the first to publish a scientific textbook in 1728 on the techniques and practices of dentistry. In the 1840s, the world's first dental school and national dental organization were established. From 1846 to 1855, new dental techniques were being invented, such as the use of ester anesthesia for surgery and the cohesive gold foil method, which enabled gold to be applied to a cavity. Therefore, dentistry from various countries found many techniques which has made a problem to resolve faster. We should be thankful to the dental surgeons who have changed the world. I thank myself and the respected teachers and lecturers who have given me an opportunity to speak over it. Thank you.
Thank you, Prajan. I request Andrea ma'am to speak about today's speaker.
Good evening, everyone. Good afternoon. It is indeed a beautiful evening, all soaked in the delighted frame of mind. This evening, I have the pleasure of introducing to you the chief guest of the event, Dr. Denzy Lawrence, Chief Curator and founder of Public Health Dentistry 101. Dr. Denzy Lawrence has acquired degree in Bachelor's Dental Surgery from Bapuji Dental College and Hospital and Master's in Public Health Dentistry in Bapuji Dental College and Hospital and was a university rank holder. Dr. Denzy is not only a dentist, but also an academic counselor, also delivers motivational lectures to students, engages in co-curricular activities and enrichment programs. His passion is to render service to old age homes, schools for blind, and child labor rescue mission. I take immense pleasure to invite Dr. Denzy to enrich our students with his deep knowledge of dentistry. Thank you.
Thank you, ma'am. I gladly request our principal, Dr. Vinay Ranganathan sir, to speak on this webinar.
Okay, so good afternoon once again to all. So it's so nice to be together online, and quite frankly, I feel sometimes online has brought us closer, because concepts like webinar and bringing together, different people from different personalities all across India was never, a possibility before, at least, in our minds. But this kind of COVID pandemic has brought all of us, closer in this way. So I'm very happy that today, once again, we are, here to share another interesting and insightful session. So first and foremost, when I think I have to thank Vinita ma'am, who mutually introduced us. And when Vinita ma'am sent Dr. Denzy's CV, right? I did not know what to select out of it, because there were so many achievements already. And the minute in fact, Dr. Denzy, when I saw your seminar, saw your CV, I thought you must be around 55 to 60 years old. the amount of achievements in the CV. If somebody has to inspire our students to take up a career, in dentistry, it has to be you. So once again, very warm welcome. Thank you very much for being here. The main agenda of the session, I would say the main motive of the session. So we have our high school students, that is 8th, 9th, 10th, our first PUC, that is 11th, and then 12th, that is our second PUC students with us. So there is always a kind of a, thrill and an excitement to become a doctor. Everybody has that. I think in their younger age, everybody wants to become a doctor or a police or something. But somewhere down the line, it just gets diluted. And what I have experienced, Dr. Denzy, is that when students from our neighboring areas, they come, and I tell them, why don't you take up medicine? Why don't you take up a career helping others, serving others? They say, no, sir, medical is too expensive for us. We cannot afford, right? The college fees is so much and we cannot get into, and they always think, and the other thing is, I don't like cutting bodies and seeing blood, right? So I immediately thought, medicine is not always about cutting up bodies and, seeing blood. And when I asked Vinita ma'am, do you have somebody who can, give us some insight on dentistry, she immediately recommended you. And I thought, what a wonderful career to have during this kind of pandemic. I think it's very important that our students are motivated to take something, different, and something which can help people and serve the society. So that is one of the main reasons why we wanted. The other thing is, of course, the fact that the mentality that I cannot become a doctor, right? I cannot become a doctor because of the society's pressure around me, whether it is the intense amount of studying that I have to do, or it is the parental pressure which is there saying that, oh, we cannot afford the fees, or you cannot go to medical school, you can't go to dental school, all those things. So how can we motivate the students to come out of their shell and really pursue a career in dentistry is something which I would be happy to know about also. And I'm sure our students, after this seminar, I'm sure that we are going to have a lot of interest in this field. So thank you very much for the introduction, and I'll hand it over to Dr. Denzy to take over. Thank you, sir.
Yes, sir. Thank you so much. Is my audio video clear at your end? Perfect.
Yes, perfect, perfect.
Okay, great. All right. So I'd like to start today's session by asking a very, very simple question to all our young budding students here who are ready on the verge to shape their careers, right? We have students from 8th, 9th, 10th standard, as I'm told, till first PUC as well. All of us, right? I want you to quickly use the chat box and make this an interactive session. Okay. What is the first thing you notice in a person's face? Or when you talk to someone, we're looking into little windows, right? Principal sir was talking and so many other teachers were talking, right? So what is the first thing which captures your attention? All right. Okay, we already have answers coming in. Good. Smile, smile, angry smile. Okay, good. That's nice. Keep it going. Teeth, fantastic. Okay. I mean, you don't have to answer this teeth because you have a dentist today sitting across and talking to you. Generally, any person, okay, and we're living in a world of masks. Let me tell you this, okay, and we're missing out on something very, very essential. But of course, it's the safety precautions. So, expression, style, smile, perfect, awesome. So I think there's a uniform consensus. The eyes, good, okay. Your facial appearance. Okay, if I were to put all of this together, all right, let me just give you a basic statistic. All right, now in the post-COVID situation, when each of us have started coming back to normal, or maybe we are still in that process, okay, when we look at each other, okay, a lot of our emotion with how we connect with each other invested in the facial appearance. Okay, now the facial appearance, as you can see of each other right now, okay, is comprising of the eyes, the nose, the mouth, okay, the ears, the hair, all of these things. Okay, the connecting point between making conversations more humane, and I would say, the euphemism for this is which connects us actually from person to person, is probably the fusion of your speech, okay, that's your voice, the content which you generate, which you want to talk to each other. What actually brings all of these things and becomes a certain note, or it becomes something which is comprehensible, children, all right? That is the functions of your teeth. Okay, now I'm not here to tell you about list out that what is the importance of teeth. Okay, we all know that. Okay, I'm going to go a little ahead of this and tell you that, okay, the guardians of the teeth, or the dental tissues, or dentistry for all of you here, right? There is a lot of misconception regarding this. Okay, number one, I think if I can start sharing my screen, yeah, I think then you'll be getting a better picture. All right. Okay, so I think all of you can see my PPT as of now.
Yes, sir.
Great. Okay, excellent. Okay, to begin off with, like I was saying, what establishes the connection between all of us? As of this moment, we are all connected through a digital medium, but we are all in this moment right now. That is, we are humanizing the experience. Okay, of course, because we are not able to connect to each other on a real basis, we have moved to a virtual basis. But what's important here is every single moment, okay, you establish a connection, you have sharing of ideas, confluence of thought, and all of the processes behind it. It's essentially your teeth and your oral tissues, okay, which are at the heart of it. This probably makes us notice the teeth first, or in some cases you will also understand the emotion of the person. Okay, the muscles of facial expression. Okay, like they say, it takes 70 to muscles for you to frown or to become grumpy and angry, but it takes just 12 muscles to smile. All right. So I think all of us can just start off today's session by putting on your videos and giving each other a heartful smile. Okay. You'll notice me smiling throughout my presentation. Okay. It's very simple. Okay. Smiling is very cost effective. Smiling doesn't strain you. Like I told you, medically, I'm saying it's just a little bit of effort it takes. More importantly, it conveys the emotion. Okay, so I quickly want all the children here to put on your cameras. It doesn't matter wherever you are. All of you are at homes. Okay, even the teachers, quickly put on your videos and wait for the count. Okay, we'll all do this together. Let's try to collect some synergy together. Okay, so this is sort of like a virtual assembly. You can call it that way. So just position and stabilize your cameras, all of you. Okay, so that I can see little boxes everywhere. Good. All right. So I can see all of your names with your standard and section. Good. That's really nice. Okay. So I'm looking at my window here and I can see so many people connected together. Okay. This is sort of like a virtual photographer, right? They come in front of you like this and they, sir, madam, smile, please. That's what they tell, right? So it's very easy and very effortless for all of us to do it together. Okay. So just wait together and I'm going to give you the count of 3, right? Together, all that I need you to do is to smile as wide as possible. Okay, we call it the molar to molar smile. You know, your dentist goes behind your molars and tries to check everything. But whatever is your natural smile, trust me, you will connect with each other and this will become more livelier for the session to follow. All right. So follow my count on 3, 2, and 1. Okay. Smile. Everybody smile. Okay, take a moment, you can just smile and do whatever you're doing. This is the best part about smiling, right? Your teeth lets you do all the other things. Okay, so I can see some of the teachers are a little hesitant to smile. Okay, it doesn't matter, students are
They are
smiling.
always like that.
Okay, students are not in the class.
Priyanka ma'am, I cannot see your teeth. I cannot see your teeth.
Yeah. So now you actually have a dentist asking you to open your mouth wide. Amadi antarala. Like that, I'm just telling everybody. Smile mode.
Nicely turning it on. Yeah.
Okay, lovely. Okay, see, this is why it's important. Like I said, we might be connected through a digital medium, like principals have said, right? Dr. Vinay has mentioned here. It could be, but all of us are invested in this moment. Okay, all of us are in the sense, you know, very connected to each other, and we're trying to learn and hear and whatever little. Okay, so good. Okay. So for a change, you're all of you, it's not a virtual dental checkup. Don't worry. If I need to do a checkup, I will come to you and I will tell you to open your mouth more than you can. And then I will take my instruments and go around your mouth and make you very uncomfortable and then tell you what is wrong with you. Okay. For now, I'm just asking a smile. All right. Good. Okay. Thank you. Thank you so much. All right. So now when we go back, right, I've been told to talk to all the students about career opportunities in dentistry. Okay. Very simple. Why dentistry? Why is it more relevant? And when you have such a unprecedented situation, okay? Now the COVID pandemic, when we noticed this, is something which none of us were prepared for, okay? Mainly because none of us saw it coming, but that's how uncertainties are, okay? When we notice that such an outbreak, a pandemic engulfing the entire world has brought in a lot of uncertainty. Okay, I'm sure the certainty what you are familiar before this was the Heisenberg's uncertainty principle, which I think some of my chemistry friends will be remembering. But all the uncertainty we know right now is kabhi bhi kuch bhi ho sakta hai, right? In this kind of a world, all of you students are at a very, very important and crucial time of your lives. First things first, let's not blame the scenario or the situation that we are in. Okay, like they're saying, you need to start to be optimistic about everything. Okay, there will be life which is normalized. Okay, there will be some terms and conditions which will apply, but there will be normal life, there will be normal emotions, there will be happiness, there will be sorrow. They'll Everything of it will come back, but in a different state of mind. Okay, so it's important for you to understand that don't give up on hope to begin with. Okay, I know that it's easier said than done, but even when I was in this situation, you know, you are bound to be confused, you're bound to be bombarded with so much of a barrage of information which is there thrown upon you from several sides. So medicine, engineering, architecture, armed forces, there's so many career options, right? But today I'm just going to give you a walkthrough okay, in a very unconventional way. I'm not going to be asking you about your dental formula. I won't be asking you what are the functions of teeth, but I will be taking through the whole process of dentistry through pictures. Okay, because let me tell you, I'm a dentist, I'm also a photographer. Okay, so I thought something which the students would like, so some pictures and some captions which are there, and then we'll take it in detail. Okay, to begin with, yes, everybody, hello there, my name is Denzy Lawrence. Okay, so thank you so much, the authorities there at Charan PU College, of course Vinita ma'am, for connecting us and for making this possible. I'm so immensely grateful to everybody who made this possible and for giving me the time to interact and to share my experiences with the students here. Now, coming about perspectives and shades, right? What is the essence of something? Before you consider any profession for pursuing higher education, okay, dentistry and how you need to go in advance and develop it, let's understand the essence of doctors, who are working for teeth, okay? Doctors who are the guardians of smiles and oral health. So to begin with, there are certain misnomers which are commonly seen. Most of them think, okay, I think 90% of them think that dentists only take care of the teeth. Okay, now there is a small correction which has to be done here. The word dental, okay, in fact one student wonderfully, he mentioned the branches of dentistry here. The common suffix or prefix which is given to this is dontics. Okay, so pertaining of and related to teeth. So when you're talking about teeth, it's not just what is visible to you, okay, not just the enamel portion or the crown portion which you're noticing, but it's about all the oral tissues. Okay, there's a lot of gingiva, which is gums into your mouth. There's a lot of bone. There's a lot of tissue which is there. So complete oral health is the responsibility of a dental surgeon. Okay, and that is why we need to understand that you're having dentistry encompassing not just the dental tissues but also the oral health tissues. All right. Now, when you go in detail and try to venture out, okay, I'm trying to share some perspectives and shades here for all of you to identify. Okay. Now, like I said, all of these are pictures, okay, which I had the fortune of capturing because I'm a photographer by choice, who also likes, because obvious relation, I like smiles and I also like capturing them. So it's very simple when you try to find out that, in that perspective, how it works. Okay. So picturing moments in a different way. Okay, let's understand the. Okay, love conquers all things except poverty and toothache. Okay, now this first statement for all of you students here, when you notice in detail, right, is making sure that you are having, so many things in the world today. Okay, when we're noticing anything in terms of, what can be done and why are things, teeth important, all of that, right? So it's a universal emotion when it comes to what all can you actually lead on into life, right? So we have at the core of it, at a profession for dentistry, that you have everything which can be conquered and can be taken apart. Okay, but toothache, okay, I'm sure all of you would be experiencing. I don't know how many of your children are unfortunate to experience toothache, but we see a common prevalence. Okay, just because teeth are present and they are continuously being used, and because the entire population has got a lot of dental needs and requirements and treatments, that makes us all the more important as a profession, because we need to give special attention to it. And that's the reason even in India, there is a second misconception that there are so many dentists just because you can visibly see them. Okay, so I'd like to come to debunking the second misnomer as well, that in a country of 1.3 billion people, okay, imagine every patient, okay, having 28 to 32 teeth of permanent teeth, the number of requirements. Okay, so this is something which has to be understood, that it is not a field which is saturated. Okay, people might tell you that there are so many dentists and all of that, but I, being from my field, I am going to endorse this view and saying that there can never be enough for a country this huge. Especially for Indians, the burden of oral diseases is very high because of major factors. Okay, now there are established scientific evidence which links diabetes to oral health, which links cardiovascular disease to oral health, and all of you are grown-up adults, right? All of you are familiar with these things. So there is a lot of change in the kind of oral diseases. Okay? It's not just only cavities. Okay, it's not only having more of chocolates and having cavities. That's just one of the several problems affecting the teeth. Remember, God, in fact, has made so many different parts of our body so specialized. If I give you a very fun fact, the gums in all of your teeth, right, which are supporting the teeth, they are a highly specialized type of mucosa. And you won't believe this, that no part in the body can be moved throughout its lifetime. Okay. And you can actually come across, I'm sure most of you here would have underwent treatment for braces, okay, for teeth which are proclined or retroclined, all of these things. So teeth are probably the most beautiful of God's creation, where it enables you and entitles you to move the teeth along by application of forces. So why did God have to create something like this? Because as we grow, the development of our jaw, the development of our eating habits, the food requirement, and all of these things. Apart from these things, even your first part of digestion happens in the mouth. So when you have such a complex set of anatomical structures present in probably the most unique part of the body for something which is so important, that is why dentistry as a profession has evolved towards such a diverse area. Today in dentistry, you can do masters in about 9 or 10 specialties, which are I'm just giving you the overview, where you can actually go on and practice in a specialized area. You could be an orthodontist, you could be a periodontist. Okay, when I say orthodontist, it's basically orthopedics is the one who deals with bones. We deal with the ones which basically move the teeth, so your braces and your clips and your Invisaligns, all of these things, right? So because facial appearance gets so much of importance in the overall self-esteem, okay, how many of you would have felt, the first thing, you wake up and you look up into the mirror and then you notice your smile, okay, and then when you upload your Insta stories or Insta reels, it's the presence, it's your smile which lights up the room. Okay, so importance of that, automatically patients seeking for such kind of remedy is going to be there. All right, so just giving, touching upon the main aspect of that, I just would like to, given that in detail. Next is a particular quote, which says that if it isn't affordable and accessible, it's not applicable. Another third, which is the number 3, disclaimer, or I would say the myth regarding dentistry, is dentistry is expensive. Okay, and this is probably by means of experience of many of our lecturers here, teachers who probably availed some kind of a treatment. They would come across and say that dentistry is expensive, but the fact is dentistry is not expensive. Okay, ignorance is. Dental tissues, if taken care at the right point of time, they are erupting the moment you're born. In fact, the development happens much before that, and that is why we have a specialty called pediatric dentistry, which takes care of the teeth of the tiny tots. Okay, so the pediatric dentist specialty is only related to that because there's a lot of translation, a lot of dynamic changes which is happening inside your oral cavity. And because children and the eating habits and the needs, because of the 2 sets of dentition, the milk teeth and then the permanent teeth, there are needs and requirements. And today you can specialize to become a pediatric dentist and a preventive dentist. Okay, but remember, the entire cost of dentistry is inflated only because there has been commercialization of dentistry. Okay, so I specialize in something which deals with provision of free dental services. Okay, so you could actually consider, specializing, maybe getting into dentistry to actually giving affordable dentistry. Okay, don't be in that notion that if I'm going to get into BDS or do MDS, I will only have to open a clinic and only have to deal with patients and probably have rich patients paying me a lot of money. It's not like that. Okay, that's just one of the ways how you choose to practice. Remember, you're a doctor at the end of the day. You will serve with social commitment and you will serve with that consciousness where you can actually help people have a better life, can have a more, improved quality of life. All right, so that's how the whole idea works. Okay, let me know if the audio video is everything clear. So can I continue any of them?
Yes, sir.
Okay, great. Okay, now this profession, right now, when we come across dental diseases, okay, we have to understand that oral health is an essential component for general health. Okay, even when all of you children go to a doctor for checkup, all right, the first thing is they tell you to open the mouth and show your tongue. Okay, because you know that this is the commonality of diseases. Okay, so a lot of dental diseases, okay, be it cavities, be it gum problems, be it bad breath, be it irregularly placed teeth. Okay, I'm using common terminology so that all of you can relate to it. We know the solution to it. A lot of dentistry and dental surgeons are working towards providing services, so it becomes like a essential service. The reason people don't know, okay, that dental diseases can be avoided much earlier is because there is a huge lack of awareness. Even now, trust me, 6 or 8 out of every 10 patients who come to me, okay, probably hadn't even heard of any kind of prevention. They would have walked up to a doctor after trying everything in the bag. Okay, they would have tried some Ayurvedic medicine, they would have tried to chew clove overnight, they would have tried some indigenous methods. Okay, finally when the tooth pops some painkillers, and eventually when it becomes uncontrollable, that's when they come to a doctor, right? That's when they come to a dentist. So you must understand that this is not the problem which we are facing, where we don't have a solution. Okay, we have a ready-made solution, and I'll give you an example of that also, how we can prevent cavities and how we can let it advance. Okay, and this is the beauty of dentistry, and that is why I tell my students, most of them, right, or dental students, that dentistry, the word, if you break it down, okay, it's a doctor and an engineer and an artist. Okay, so I want you to remember this very clear. Okay, the word dentist itself, the way I put it, is a doctor, as an engineer, and as an artist. So if you are students who are interested, okay, in a lot of craft work, who's very artistic in nature, trust me, you will love dentistry as a profession, because there's a lot of handwork which goes into it. Okay, remember, we are dealing with such an intricate part of the body, and in that part of the body, imagine that the machine which is used to cut tooth, human tooth, which is the strongest substance in the body, right, the enamel of your teeth, is running at a speed of 2.5 lakh revolutions per minute. All right, so the machine which you use to cut, imagine the amount of dexterity, the amount of art and craft, and the control you need to have. So it is a very challenging profession in terms for, and very appealing to the ones who are a natural artists. Okay, so handwork is very important. That is why dentistry is 1/3 artistry. Coming to concepts of engineering, okay, why do I say, if you are the kind of student who likes to build something, okay, who likes to put the pieces together, who likes to make things work, okay, literally in the sense, if you would like to engineer something, the literal sense of engineering, then dentistry is a profession for you. And above all, the feeling of satisfaction of being a doctor, because patients come to you with tremendous amount of pain. Trust me, you break your arm, you tear your skin on your palm, on your leg, or rest of part of the body, you can still bear the pain. But if you have a toothache, the ones who have had it only will realize this. Okay, toothache is unbearable. So God has given such important structures, and he's also given the nerve supply, which is so intricate that each single of your teeth are supplied by a plexus of varied kind of nerves connected to various centers in your brain. So toothache is something which, a godforsaken thing, which I wish nobody endures or nobody has to face. So you're a doctor who was actually relieving that patient of toothache. And imagine if you, being a doctor, provide a means of ability for old age patients. A lot of patients I provide dentures, I provide kind of restorative and rehabilitative options. I give them dentures and then try to understand that how it has changed their life. Okay, there would be people above the age of 55, 60, 65 who would have lost their teeth. Okay, natural process, teeth decay or teeth become loose and eventually fall off. So when you notice all these things, you providing a denture, okay, that level of satisfaction that the patient is able to smile again, the patient is able to chew again. Okay, see, today we spend so much of time in gratification. Okay, if you're not able to enjoy food, you're not, they say it's a life which is not spent worthwhile. Okay, so your ability, automatically quality of your life is impacted by the teeth. So there are specialties like prosthodontics, the boy mentioned there, is exclusively dedicated to building bridges. Okay, bridges, when I mean, say, bridges inside the mouth, not on your flyover. the bridges which are there, inside the teeth, which take the support, which take a lot of mechanics and neuromuscular, functions into account, and then construct. That is why I say there's a lot of engineering aspects, okay? Be it a single crown or a bridge or an implant, okay? Today, there have been so many advances in dentistry, which allows you to drill a screw into the bone, okay? Like we all know, the natural tooth, the crown and the root structure is cannot be replaced. But if at all it has to be replaced, today we have screws which are made out of a special type of material, for example, the titanium implants which are available, and there are implantologists who drill the screw inside your bone, and you will actually see magic. Okay, you will see magic in what sense? That the bone around your jaw will grow around these things, and it becomes integrated, and it becomes completely an artificial tooth which doesn't need any other kind of extra support. This is the level of advancement of dentistry which all of you students should be aware of. Okay, and this is why it makes dentistry an exciting, a challenging, and a very, very promising career for you to think about these things. Now, coming to one statistic here, right? Like I said, 51 million school hours. Okay, a lot of you children going to school would have probably complained. Okay, I know how many times you have a real illness, or how many times you fake an illness to skip school or bunk the class. It doesn't matter. Okay, now you're in an online class, so you can't give reasons also. So when you talk about giving reasons, for things, actually absenteeism, a lot of children miss out on schools, and people don't know this. Okay, people think that dental related illnesses can be neglected and can be ignored. But what happens is when it gradually keeps on accumulating, you'll notice that a lot of school hours, okay, a lot of, you're not able to concentrate, you're not able to eat, you're not able to do anything. And that's when your dentistry becomes very important, because a lot of absenteeism is seen in schools. Okay, and that is why we have treatments. In fact, in this picture, you can notice that we are having a small syringe. We're not giving the student, the child, an injection or anything of that sort. We are actually applying a small resin-like material, which is going to seal the occlusal surfaces. Okay, when I say occlusal surfaces, means your teeth are having a biting surface. Okay, so this biting surfaces is one which are actually sealed by using a small material which is so minute that even your toothbrush bristles don't reach them. This is how we stop any kind of dental caries from happening. Okay, and these are called pit and fissure sealants. So this kind of a material is actually giving 100% protection, so your tooth remains intact. There is no caries which is going to happen from these grooves or crevices, and invariably you're protecting the tooth for the entire lifetime. Okay, this is the kind of treatment which pediatric dentists do or public health dentists do. So a lot of preventive treatment, like I said, is there in dentistry, which is there for you to explore and to work into these areas. Now remember, okay, basic oral hygiene. Like I said, a lot of preventive aspect has not been accomplished. I'm sure a lot of children here again, though you would say that I do brush twice a day and I would do all these things. Okay, it's not an oral health session for you, but remember, there are a lot of job opportunities for dental health professionals as educators, as the guardians of oral health. Okay, so that you are able to advocate the issues concerning the public. Okay, and let's remember, everyone has teeth, everyone has requirements. Okay, it's not an exception that I will never require to go to a dentist. So there is a lot of education opportunities in dentistry, where you can choose to become an educator, you can choose to become a community officer and work in awareness programs, and these are all present along with the medical faculty. Okay, so you get to work with them, you get to educate them by using newer technologies. You can use the social media creators. Like I said, remember, dentistry inherently is for those ones who are very, very creative. Okay, so you can give out your creativity here to the fullest and make sure that you're able to do justice to what you are actually good at. Okay, here is again another statistic. 90% of all the carious lesions in the mouth, okay, carious means the cavities which happen, they occur on the occlusal surfaces. That means the story for dental caries which you have been seeing through advertisements, that कीड़ा मकोड़े आ जाते हैं and पूरा वो दांत में कीड़ा पड़ जाता है ना, तो ये जो पूरी कहानी है, when you notice this, okay, this all starts by what? You don't brush properly. More specifically, you don't brush the specific areas. Okay, this is how you need to educate. This is how you need to make sure that these are how you understand the disease process, and that is how you can contribute. Okay, and there are specialties for these things. Okay, there are specialties like oral medicine and radiology, who are completely going to examination of all the tissues, and they give you a graph, they give you an estimate that what is your chance of getting cavities, what is your chance of avoiding, what you should avoid, how you should incorporate fluoride, all of these things. Okay, so that's just a bit of statistic for all of you. Okay, this again, like I said, plaque control. Plaque is the one which accumulates. Sugar restriction. Okay, there's a lot of opportunities there, because you read a lot about diet and nutrition in dentistry. Okay, because it's not just what you eat, the timing of what you consume. Okay, this is why it's important. The longer it stays, the longer it's going to cause a problem. So there are a lot of specialties. Okay, for example, the department of periodontics. Okay, it involves around how they create awareness, not about the tooth, but about the supporting structures. Okay, the gums in which is commonly referred, right, scientifically we call it the gingiva. Then below the gingiva, there are fibers, and fibers are anchoring these gums or gingiva to the bone. All right. So a lot of your health of your particular tooth depends upon the integrity of your periodontium. Okay. And that is how you have specialties which are advanced in that as well. Okay. That's why it's important. The dentistry is not filling cavities. Okay. I'll come to my fourth myth, which is going to be busted today. Okay. I hope all of you remember what I was mentioning from the beginning. Towards the end, I'm going to be asking some questions and see how much you can recollect. Okay. The fourth misnomer. Okay. People think that dentistry is only about drilling and filling. Okay. That means we drill and fill. Okay. That's not even 10 or 15% of what is actually done in dentistry. Okay, or dental education. A lot of education, a lot of motivation, a lot of behavior modification. Okay, remember, each of us or all of us require a comprehensive dental solution. Okay, everybody, even a dentist requires another dentist. I can't operate on myself, right? So when you have this kind of direction and need, automatically that is the reason why, though dentistry has got an immediate past of, let's say, 100 years in India for that matter, but it is one of the most rapidly advancing specialties in the entire world. Okay, and I'll give you a very, very interesting fact from overseas. Okay, what if I told all of you that the most highest paying profession, okay, in the United States, the most lucrative profession after lawyers or advocates, who are attorneys, are not the medical doctors, but are the dentists who are earning the most. Okay, so even if you're someone who wants to make a lot of money, who wants to make name, fame, and be successful, dentistry is a choice. Like I said, it's a very, very broad discipline. Okay, in dentistry, again, you can choose what you want to be. Okay, and a lot of these things, I'll just share a personal experience. Most of them, in dental college, what happens is they come to dental because they don't get medical. Okay, when all of you now or in a couple of years will be appearing for your NEET examinations, and we'll be having options, right? People have probably seen the way the medical professionals work. Okay, that's why they relate more to them. So there is the tendency. So if you have decided, okay, that I want to become a doctor, okay, I'm going to talk about the barriers towards the end. What actually brings you towards dentistry? Okay, people come here, okay, most of our dental colleges and everyone, they say that, so we came because we did not get medical field. Okay, but when they come here, okay, it is a profession which has got very, very high levels of satisfaction, because various talents in them. Okay, if someone is good at art, someone is good at behavior modification, at speaking skills, someone is good at building something or working in the laboratory for a long period of time, wants to create something, or someone is good at dealing with patients or traveling, so many things, right? Being a doctor, you enjoy each and every aspect of your life. Okay, and dentistry is no exception to that, because remember, in the end, you are the smile makers for the society. Okay, imagine if that one particular smile takes away all the fatigue. Probably the whole night I would have been sitting and fabricating that denture, but that kind of satisfaction and that kind of gratification is completely unmatched and unparalleled, and which only doctors are I would say privy enough for that. Okay, simply because we deal with real lives and real tissues, where your subject is a patient, is a live patient with emotions, with pain, with distress, and all these things. Okay, so if you talk about the post-COVID area, students would be scared that whether I should become a doctor, so much of negativity is happening. No, you must understand that there's a reason why they equate the status, and in no way this is to glorify doctors or anything of that sort. Okay, it's a very, very important responsibility. So all of you in this generation, right, you are far more advanced, you are far more better placed with so many skills that I would say that you ought to be doctors first and everything else. Okay, and like I said, you don't have to distance yourself that, okay, if I'm going to be doctor, I will have to spend a lot of money. I will have to spend many years studying, because a doctor keeps studying forever and ever and ever, right? But you understand that you deal with patients, you deal with real people and real life. So you have to update yourself. Okay, like I said, in dentistry itself, there are specialities where you can do masters. Now, I have had the fortune of completing masters in public health dentistry. Okay, in my specialty, what we do is we do multiple camps. We go out, we have a big white bus with 2 dental chairs, and on a daily basis I travel to schools, and me and my team, we work on patients, we do treatment in the field. Okay, if you're someone who's interested in that, there is a provision. What I'm trying to tell you is there is something for each one of you and every one of you in dentistry. Okay, don't limit yourself by restraining and saying that, "Arey, no, I can't see blood, I can't cut." It's not. Okay, you could be a dental health educator. Okay, you could be in academics, you could be teaching in colleges. There's so many opportunities. You could be a part of governmental projects. Okay, governmental projects related to fluorosis, related to oral cancer, related to tobacco control, so many things. Okay, so don't make a hasty decision based on other people's opinions. Okay, think for yourself. Okay, again, even today, don't follow something because I said so. Okay, please verify. Now, you kids have the power of the internet. You can read up, you can find out information brochures, you can research about everything. Okay, how much to be researched before ordering something on Amazon, right? All that you have to do with career options, you just have to research, consult people, consult experts from different fields, and then come to a decision that what is best for you. Okay, and I would put it this way: in a world where you can be anything and anyone, all right, this is an option. Like they say, this is a world where you can become anything and anyone, and given the speed of technology and learning abilities, fortunately or unfortunately, COVID has given us the power of the digital medium. So you can learn, you got to be a learner each day. You got to be exploring options. Don't stick to only traditional options, okay, because someone said so. Okay, now all of you are students with an aptitude in science, who are backed by evidence, who have logical reasoning. So find out the options. And like I say, in a world where you can be anything and anyone, be yourself. That is important. Okay, being yourself. There is nobody like each of you, right? Now I'm seeing at the window of so many students, who are attending this session. You are the best version of yourself. Okay, you come with individual qualities, who is good at few things, and there is nobody like you. As far as human possibilities are concerned, they cannot be. Even your own brother and sister is not like you. All right, even if you're twins, they are not, because we are equipped with the most powerful tool in the world, which is your mind. Okay, remember, this is the most powerful tool which each of us has. You can think for yourself. You can listen to 100 people, you can listen from sources, you can find out from areas, but you got to think for yourself. So you are already equipped with that, and all of you are high school students and first PU and on the verge of entering the real world. Okay, know about options today. Okay, you'll probably get a little bit of information about dentistry. Okay, learn from other people, learn from YouTube tutorials, and find out what it is to take. It takes, whether to become a medical professional or a dental professional or a lawyer or a teacher or anything. Don't go by the old definition, okay, which probably our parents and grandparents had. There are a million occupations and there are a million possibilities, and today I'm just giving you a drop in the ocean related to a little bit of knowledge which I know about dentistry. Okay, like I said, in a world where you can be anything and anyone, you got to be yourself. All right, make the best version of yourself. Make an analysis of what you are good at. Okay, what skills you're good at, what subjects you like. Okay, trust me, I am someone who liked reading history and civics and geography throughout my entire life. Okay, and I still do that. Okay, the most favorite things which I watch are historical epics, biographies, and I'm someone, classically, if you see, I'm a humanities student. Okay, but I discovered the passion and interest for dentistry and for public health dentistry as a maze of means. Okay, so about 12 or 13 years ago, I was exactly in your same situation, trying to contemplate, and we were not having the privilege of such a 4G network where I could research about everything. But still, I liked social studies, I liked history, civics, and geography, to be very frank. And trust me, my lessons for my history class, I remember them even today. Why? Because that's something which I liked. Okay, you would also have the same thing. Okay, I also remember my history teacher, what she said, and the various parts, and how I sort of visualized the World War II when I was sitting in my history class way back in 9th standard and 10th standard, right? That remains. That means things which you will like, you will continue to like no matter what. Okay, profession is something which gives voice to that particular aspect. Okay, so if you're talking about professional abilities, choose a profession. When it comes, it doesn't have to be dentistry because you listen to an hour of session today to me, right? It can be any profession. It's important to have a well informed and a balanced opinion. Okay, like they say, you find it difficult to convince people that they can greatly control their own dental destiny. Okay, this is what we say. And with dentistry, people have to be told that they are the guardians, they are the custodians of how well they can lead. Okay, like they say, a healthy life and healthy future. So you need to make sure all of these things which are there. And trust me, in this world where we are deeply divided, there's a lot of inequality, injustice. Okay, the injustice in healthcare, and this is said by none other than Martin Luther King Jr., that injustice in healthcare is the most shocking and inhuman. Okay, even if you notice, all of us here are privileged and we are fortunate the reason where we are. And that's how we understand that how uh, mm, fortune we are, that we are able to at least fend for services and we are able to avail your treatments. There is an entire world which resides who don't get basic access, even to something like the smartphone each one of you are holding and attending the session. Okay, so get in terms with reality. And when it comes to your idea of how people are very, very diverse opinions and they are not having access, and there is a lot of inequalities in the society. Okay, healthcare injustice, and you won't believe this, even in the COVID situation, healthcare injustice is probably the most shocking and the most inhuman one. So I don't have to tell you students that this is something which has to be dealt with or has to be told. These are normal things which you automatically identify and see. Then we see that individuals with physical, mental, emotional problems, they have a greater need for dental care, okay, compared to your other counterparts. So that is how you see, in terms of, summarizing with this particular quote, which says, doctors, right, like we say, the medical services or dental professionals, it's not an issue of a couple of doctors working in a hospital or giving some services. Remember, if you choose this profession, that if you choose to be a medical or a dental professional or take up this particular line of work and justice, you're actually contributing to social justice. In fact, I just like to mention, right at the beginning, I saw a portrait of Dr. Baba Saheb Ambedkar hung up on the wall of your principal, sir. He is the epitome of social justice. Okay, Dr. B.R. Ambedkar is someone who resembles and make sure that someone is there. And we read about so many such great leaders. So remember, if you choose to be a healthcare professional, okay, you are doing a far greater service compared to your counterparts, and you are contributing in nation building at your own very, very best capabilities. So that is how social justice becomes very important. Now, quickly, I think I'll just run you through a couple of slides which give you keywords. I want you to pick up on these and try to find out the meanings of it and how they are connected. Okay, so I of course I will be sharing my presentation, so all of you can go through that in detail. But quickly, let's give you pointers that why is it special to be a doctor or a dental surgeon or working with patients, which make you really, really effective and really satisfying in terms of your professional abilities or in terms of skill and capabilities. Empathy. Empathy is what? Empathy is placing yourself in someone else's shoes, right? So the human connection to patient care, okay? You are not repairing a microwave or a camera or a mobile phone. You are dealing with real people, okay? The ability to understand and share the feelings of one another. And being a doctor, trust me, nothing brings you as close as this to being connected with patients. Okay, so there is a human connection which automatically comes by treating patients. So you must be really, really, happy and delightful to do something in that direction. Next is social consciousness. Okay, all of us here, everyone, right? This is irrespective of caste, creed, religion, sex, whatever it may be. Each one of you already has a consciousness. Okay, they say your conscience, right? That you want to do something for the community. In fact, this COVID pandemic has brought to light so many people who are doing so many amazing things for the benefit of the society. That is why, to be conscious or aware of the problems within a society or a community, being a doctor or dental professional gives you that kind of ability. Okay, you get to do a lot of community service, you get to visit places, you get to examine, patients as small, as 2 month and 3 month olds to 80, 90-year-old patients. Okay, look at the wide spectrum. Okay, now in a way, there is dental requirement for everyone at every age. So nothing brings you as close as, dentistry or public health dentistry specifically to community service. Third is equitable. Okay, when I say equitable, you are looking at provision of services irrespective of your position in your society. Okay, unfortunately, the healthcare system in our country, many people keep complaining. Okay, it's more, the private sector, and people are not able to afford. How is it going to come to normal? Okay, I'm not someone who believes in complaining. I believe in, even if you're able to do a little bit of service in a positive direction, your job is done. Okay, so you are able to take up dentistry, or you're able to take up the medical profession, you treat everyone fairly and in the same way. So you make sure that your distribution of services are possible on an equitable scale. That is not based on, who is placed where in the society. Okay, it's more dependent on who needs it the most, and that is how you have to take it forward. Prevention. This, please students, I think all of you need to go and spread the word and tell the dental diseases, all the diseases which you come across, your caries, your gum problems, your fluorosis, your oral cancer, everything can be prevented. Okay, the only reason people end up paying, exorbitant bills at the dentist is because of their own ignorance. So you need to stop something from before it is going to happen, right? So prevention is actually, we hear this common phrase that prevention is better than cure, prevention is that than cure, all these things. Let me tell you one thing, prevention is the only cure. Okay, when you're talking about only cure, that means in the long run, you must be able to make people, that is your patients or the community, take care of their own health. So make them in a position. And how do you do that? You do it by providing services which are preventive, promotive, and curative. Okay, a lot of dentistry works in preventive treatments. Like I said, that example of a sealant which is used to place, or fluoride treatments, or curative treatments like a root canal specialist, the endodontic department does that. Like this, you are including and dealing with all the elements of particular patient requirements. And finally, like I said, a lot of education and empowerment goes into this. Okay, remember this, it's it's this very famous the quote from the Bible. They commonly say that, right, that you give a fish to a man, that's going to take care of his hunger, right? But if you teach him fishing, it's going to make sure that he takes care of his food requirements for the rest of his life. All right, so this story, this fable, which we hear from the Bible, right, it's there, it's about educating, it's about empowering. You are enabling someone for the rest of their life. Okay, and dentistry needs people, for this purpose. We need people who can go and teach simple toothbrushing techniques. Okay, and trust me, this is something which will go a far, larger way in solving the problems which the people commonly come across. And finally, a lot of dentistry is related to how we integrate and collaborate with the other dimensions. Okay, teeth are not isolated, that they're not connected with the rest of the body. Okay, teeth are connected with very well with the rest of the body, and you would experience this. That is how we work with medical professionals, we work with the other, allied health sciences, bringing together multiple dimensions. Okay, today the concept of being healthy does not mean that you're free from disease. Okay, just because all of you don't have toothache, that doesn't mean you are dentally fit. Okay, you must understand that health, is and this is the definition by the World Health Organization. I'll just, tell it out to you so that you get a better understanding. Is a complete, a state of complete physical, mental, and social well-being. Okay, health is a state a complete, physical, mental, and social well-being, not merely the absence of a disease or a disability or infirmity. Okay. Finally, being healthy also means that you should be able to lead a socially and economically productive life. So be it your parts of the body, be it your teeth, or be it any other parts of your organs and tissues, you must be able to function properly. Okay. If you're not able to function properly and lead and contribute, then you are not considered healthy. So going by that definition, none of us here are healthy. But the point here is, you must make sure that you are participating in a profession which is adding, value to the effectiveness of a human being through their lifetime. Okay. This is why the multiple dimensions of health have to be understood. Finally, communication and advocacy, right? A lot of dental diseases, we require people. Okay. If you go up and search on YouTube, you'll find a lot of videos and all of these things. Communication is important. Okay. Today we're having a session where I'm sharing whatever little bit of information, ideas, what I have with the rest of you all, so that all of you can connect and then could, bring some kind of change. So there is a lot of opportunity which can be done. And finally, no kind of a law by the government or a regulation is going to improve the health, specifically the oral health of the general population. Okay. Why? Because here the people need to come together, the patients need to come together with the policymakers, the politicians, and the dental professionals, with a shared understanding that how oral health is important to general health. And that is the only utopian idea, where one day, someday, that we're going to have a cavity free future. And you might as well be a part of that by actually being a very functional, component of this particular workforce. Okay. Quickly, I think I'll just summarize for today's session. I hope I'm not shooting up time. Whatever pictures you all saw, right? Everything have been, captured, on various experiences, and I've put in a lot of, personal anecdotal, content here for this thing, right? In the quest for humanizing perspectives, okay, when words become unclear, you try to picture it with a photograph, and each photograph tells you or attempts to give you a story. They resonate with you, with experiences, they fiddle your imagination, they actually transcend your thoughts, and above all, they teach us to picture things in a different way. Okay, I'm sure your English teachers here are far more proficient. I'm sorry for my grammar or any other kind of mistakes, but this was a collection of all those moments which I feel, and I have established a connection with my profession. When you're able to do that, I think that really brings a smile to everybody's face. And remember, that's what we started today's session with, and I hope we're going to end today's session also with a smile. So thank you so much for such a, a wonderful opportunity for, giving and interacting. I think now I'll just like to pass on the proceedings. If there's any question and answer sessions, please feel free to reach out.
Thank you, sir, for taking us into the world of dentistry to your words. So here our Charanites are eagerly waiting with interesting questions. Please help them out.
Students, please raise hand.
I think we have Deepika. Yes. Yeah.
Good afternoon, sir. Myself, Deepika Sri, and I am from Secondary C Science, sir. So I have a doubt, sir. When can we go for less price of medication, sir?
When can we go for?
Less price of medication.
Yes. Okay. Now the reason, that's a good question, Deepika. I think you're a very concerned, young citizen who's, worried about the prices of medication, right? You're
Yes,
thinking
sir.
about the cost of medication. And if I'm correct, can I see braces in your mouth?
Yeah, sir.
All right, fine, great. So when it comes to medication, right, provision of essential medications, which of course the government is doing great work in that direction. We've been having a lot of subsidized. Now, I can speak for dentistry and my field, medications or treatments in general. Nothing turns out to be costly or expensive if there is a collaborative effort. Okay, it's like, it's not a commodity which is private controlled, where you can't control the pricing. Okay, definitely you can bring in regulations, you can bring in reduction of taxes and make medications affordable, and that has to be brought about at a policy level. Okay, you, me, or anyone else cannot really bring down the prices, because it is completely in the sole responsibility of the government, which can actually monitor this. So we would look for effective monitoring of food and drug regulation authorities and the various concerned departments, which can bring down. So something which is very expensive can be made very cheap. I'll give you a dental example. Okay, in dental examples, most of you would have come across this, that treatments are very expensive. Okay, the reason being, most of the dental materials which are used, okay, they're all exported from foreign countries. What happens is, when you import such kind of materials from other countries, we end up paying a 300 or 350% cess on that. There's an excise import duty which levies on them. So invariably, many of the private practitioners end up passing the cost to the patients. Okay, and that is why a simple bottle of glass ionomer cement, okay, we use it for restorations on posterior teeth, ends up being 3 or 4 times more expensive, and automatically makes the affordability very less. So yes, Deepika, I think it's good that you started thinking about this. Definitely we can make some progress in that direction. Yeah, next, I think if we have some more students. Yeah, Lavanya, I think.
Yes, sir. Good afternoon, sir. My name is Lavanya and I am from second year science. So we have heard that fluoride is very essential for our dental health. And why is it so much important? And also, how can we include it in our daily diet?
Okay, good.
I also have a question, Dr. Denzy.
Yeah,
Whenever
please.
I see this kind of fluoridated versus non-fluoridated toothpaste,
yeah,
it's like when we go to a salon, they ask, do you want this cut or that cut? I said, I don't know, whatever it is, you do it. so
a lot of
this kind of fluoridated versus non-fluoridated, I think even I'm always, very much confused with this.
Yes.
So which is the better one?
Correct. Now, there is a lot of confusion on this. Partly we have to blame the marketing companies for, throwing it in your eye and trying to, sell fluoride as the potential. But when you look at fluoride, the chemical, in that terms, the dental professionals endorse it, yes. Okay. Simply because that whatever fluoride is there in your conventional, in normal toothpaste, what we buy, okay, all the common toothpaste which are available in the counter are already fluoridated. Okay, they have a way of measuring fluoride in terms of parts per million. Okay, ppm. Now, commercially available toothpaste, be it Colgate, Pepsodent, whatever, Himalaya, and everything, right? All of them come with an amount of 900 to 1400 ppm, which is normally present. Okay, how does it act? Yes, it does make your tooth more stronger. Why? Because fluoride mechanism of action, the chemistry of fluoride is it gets into the lacunae which are present in the hydroxyapatite. Okay, now the enamel of the teeth is chemically, okay, a lot of organic and inorganic constituents of that. I'm sure chemistry teachers here would clarify this. Because the tooth in itself has got a very, very high amount of inorganic content. Okay, you're having the hydroxyapatite. In its structure, you're having a missing lacunae. So what your fluoride does is, when it gets ingested, when you consume either water with fluoride or toothpaste, when you're treating it with fluoride, it gets into it and it becomes fluorapatite. Okay, and this fluorapatite makes the tooth more resilient and more stronger. So yes, there is a topical action, which is a superficial action by the fluoride which gets into it. All right, but then again, overusage leads to a condition called fluorosis. And this is an incidental finding in most of the parts in our country, because the water what we drink itself is fluoride rich. Okay, now remember, none of your RO filters and anything of these things can actually remove the fluoride in the water. So increasing usage of deep bore wells, okay, because the groundwater is very high in constituents of fluoride, automatically they will, add up more to it. So you will notice in some people excessively white teeth, which is fluorosed teeth. Okay, that is why there is a lot of benefit and harm to it. So that's the whole idea.
Right. Thank you. Thank you. Yeah, I think we have Afreen.
Yes,
we'll
yes.
finish with the second PUC, then we'll go to the smaller classes. Afreen.
Good afternoon, sir.
Yes.
I'm myself Afreen. I'm from second PUC, and I have a doubt, like why sensitivity toothpaste is specified by doctors.
Yes. Okay. Sensitivity is a common problem which patients come on a regular basis. Okay, the reason being is your tooth structure is covered by enamel, right? The most outermost portion is a non-living entity. Okay, so normally if your tooth is getting abraded or being tarnished, you would not get to know until you go to a dentist. The only sign of sensitivity comes is when that kind of abrasion reaches your second layer of the tooth, which is the dentine. Now the dentine has got tubules, and there is this dentinal fluid in the tubules which gets a reaction or a response to anything when you consume hot or cold. Okay, so the moment you consume hot or cold foods, you get that shrillness and you get a dentinal hypersensitivity. So you are recommended any kind of desensitizing agents, be it your Sensodyne or be it your strontium chloride, anything. There are so many available. They form a mechanical barrier. And of course, the word of caution is do not use desensitizing paste for more than 3 weeks. Okay, that could lead to a loss of taste sensation or could lead to any other thing. The same holds in case for the other thing. So you must treat it with care.
But Dr. Denzy, they
Yes.
say now that the sensitive toothpaste can be used in place of regular toothpaste.
Yeah. When you use it, you are replacing it with your regular toothpaste. So
But
it is
then
essentially
only for 3 weeks.
yes. And then you go back to your normal toothpaste.
Oh,
Yes.
because I have been using the Sensodyne for
Yes.
almost 2 months now.
Yeah, that is the major problem.
Okay.
Remember, sir, that your Sensodyne is the normal, what is there, lauryl sulfate and normal dentifrice constituents, but it has got sensitizing. So you don't need desensitizing agents for more than 3 weeks or 4 weeks.
Okay.
Once your sensitivity stops, you can go back to your regular toothpaste.
Right. Oh, I didn't know that. Thank you.
Same, I just want to add one more point. Again, since a lot of you are asking dental queries, even using a mouthwash, okay, is not normally recommended for everybody. Okay, a lot of students do this, very careless. They just, rinse their mouth and continuously use mouthwashes. What happens is when you use the chlorhexidine or Listerine mouthwash for more than a period of 3 weeks or 4 weeks, you start getting stains due to that. Chlorhexidine starts to stain the tooth, artificial stain. So only when you're having halitosis, only when the dentist prescribes. Now, what happens, sir, is there is widespread availability. So it's an over-counter availability. So people think that along with toothbrushing, chlorhexidine or rinsing your mouth with a mouthwash is also good. Ideally
and they are
speaking,
also advertising it,
Yes.
as a kind of a marketing.
Exactly.
To impress the boys, to impress the girls. Use Listerine mouthwash. Samiksha is laughing.
Yes. In fact, there is a very interesting case study when Listerine, I'm sure the students would like history. Remember, I like history very much. So I'll tell you the history behind it. When Listerine was marketed in the United States in the 1920s and 30s, just to increase and boost their sales, you actually had comparison. Okay, you had these advertisements where there would be a girl walking up to the boy, and because of bad breath, because of halitosis, the boy would not want to talk to the girl, and she would feel very disappointed. And then to the rescue comes Listerine. Now,
like
technically,
advertisement.
Correct. Now, technically, like I say, children, you should not source your information from advertisements. Okay, they are selling it. It's not wrong. I mean, that's their job. But you should look at the facts and you should consult, experts in the field, and then only go ahead with that. So, yeah.
Thank you. Yeah, we have maybe last 1 or 2 questions, I think.
Yeah, sure.
We'll take it from the smaller kids. Yeah,
smaller kids.
Rakshita.
Yeah, good afternoon, sir.
Afternoon. Yes.
How often should we have a dental checkup and why is it so important?
Yes, very good
question. Good question.
A very good question, I think.
How often is a very good question. Yeah.
Now, I would give you a counter question, Rakshita. Okay. You have a vehicle at home. Your parents, anybody, they have a vehicle. How often do you service your vehicle? They give it to the service station, no, for servicing. You have machines, right? You have your fridge and microwave and all these things. Okay. There's a difference. Okay. A vehicle, even when it is running, even when it is stationary. Okay. In the COVID situation, everything was stationary. Okay. You had required it to go for servicing, even when you're not using it, right? But certain products have to require servicing, even you're not apparently facing any problems, but suddenly you find that it requires some kind of repair. So there is a difference between repair and servicing. Okay. Now, most of the problems in the dental tissues, right, are happening because constantly there is not a minute in your life where your teeth are not subjected to stresses. Even when you're sleeping, there is constant secretion, there is constant influx of food and various juices in the oral cavity tension. So it is naturally in an area which requires regular servicing, and I use this word very, very, explicitly, once in 6 months. Okay, this is the reason why they say whether you have a problem or not, you visit the dentist once in 6 months, just so that you can avoid all the problems in future. And like I mentioned, about prevention, your doctor will easily tell you that you have a cavity which is coming up or you have a problem with this. So it is important to visit your dentist irrespective whether you have a problem or not. Okay, so a regular checkup for all school students is what is required for the entire benefit. Yeah.
Maybe one last question, Tanushri.
Good afternoon, sir.
Yes, good afternoon. Yeah.
When would you see nitrous oxide sedation, and how would you ensure the safety of patients and staff?
Correct. Okay, I'm sure you're referring to the anesthesia which is used, okay, when we operate on children. Now, we use nitrous oxide sedation or the methods like conscious sedations and anesthetization because patient behavior in the chair, okay. A lot of you, when you are a lot less younger, your juniors in school, right? They are scared of the doctor, right? The moment they see the white coat, what happens is they get scared, and there's a lot of dental phobia. I don't know, do I look scary? I don't know. So the last 1 hour I've been talking to all of you all, right? Ideally, the problem is doctors themselves don't smile. Okay, when they don't smile, they automatically effeminate as a kind of sense of fear from the people. So when you're talking about the safety precautions, we must understand that there would be no need for such kind of anesthetic procedures, like nitrous oxide or something which naturally puts you at risk. Okay, unless of course it is required medically, okay, when we are doing extensive surgeries. Now what happened was, the reason why there has been a lot of noise around it is patients were not being able to manage on the chair, on the dental chair, when we operate, when we're working on procedures, simply because the sensitization was not done. A lot of doctors inadvertently started using anesthesia in order to make the hassle-free procedure, okay, so that there is no, the patient is not conscious or subconscious when we're operating. Okay, now ideally speaking, for any dental procedures, it is indicated, okay, there has to be a proper medical evaluation, and we have to make sure that proper consent is taken and the area, the clinic or the kind of hospital is well equipped to deal with emergencies. Okay, there is of course, we work with the anesthetists and we work with the pediatric dentistry, young children. Okay, now y'all are still understand what has been done to you, but there are young children who are not. So there are guidelines and people need to know. Okay, like I said, every decision when you go to the doctor tomorrow has to be a shared decision making. Okay, be informed. Okay, nobody is stopping you from asking why, what, how it is done. The more you ask, the better informed you are and the better control you are of your treatment. And also, like I said, that doesn't mean that you question the doctor for everything. Okay, you need to make sure that you leave the science to them because they are the ones who are trained professionals. Okay, you are there because they are the experts in a certain profession. So it all works upon a more, I would say, like a covenant of trust today in this scenario. Yeah.
Okay, thank you. I think unfortunately we've run out of time. We have 2 or 3 more. Maybe one last question. Maybe Eunice, since you are going to go into science, you had messaged regarding the something regarding to options, career options, something like that, right? You wanted to ask something. You had told Rakesh sir. Eunice, maybe I'll give you one last chance because you're interested in that. Tell me, Eunice, what's your question, ma? We can't hear you, Eunice.
I think his audio is not connected.
Try removing the microphone, otherwise just directly you can try speaking.
Okay.
So meanwhile, I have a silly question, if you don't mind.
Yeah, please, please. There are no silly questions, sir. Questions are questions.
I think this is something which I want to educate the children also. With all these kind of marketing advertisements, there is salt in the toothpaste, there is, black color toothpaste, there is red color toothpaste, blue color toothpaste, and, all these kind of marketing gimmicks. Now we have the clove, of course, Ayurvedic, we know that clove is very good for the, so now they have used that as a marketing gimmick and added that as in the toothpaste. So is there really, so after going one round of all toothpaste, which itself is wrong to do, I think you would say that to not change toothpaste is probably a better option. But after going one full round of toothpaste, yesterday I got confused with my face wash and my toothpaste because both were black in color. So one was charcoal face wash and one was salt toothpaste. So, so which is the best toothpaste, or how do we decide, Dr. Denzy?
Correct. Now, I think that's such a very valid point which Sir raised right now. Though it's silly, it's important, and I'll tell you why. Now, this is unfortunately the sad state of affairs that the first question a dentist comes across. Okay, it's probably if you just bump into any dentist, is like by default everybody will ask you which is the best toothpaste. Okay, the actual fact of the matter is it's not what you brush your teeth with, it's how you brush. I'll give you an analogy in your own school examples, which when I go to camps and I talk to students, right, I tell them that okay, here is a particular pen which you have, right? So you have a 100 rupees pen and then you have a 10 rupees pen. Okay, it's like asking me a question that will I write with this 100 rupees pen, am I going to get more marks? Now understand how silly the question is, right? It's how you write, not the kind of pen which you use, right? So because unfortunately the marketing techniques and everything have propagated, the saleability of toothpaste are more the commercial reason. 90% of your healthy teeth and gums depend on how you brush the teeth rather than with what you brush. Okay, so all the toothpaste are the same. If you ask me, you can just go blindly and pick up a regular, unless you have been recommended let's say desensitizing or a special toothpaste. Normally, if you don't have any problems, whether it's Colgate, Pepsodent, whatever, okay, because I don't work for any of these companies, so I can give you a very unbiased opinion, right? So any of the companies, whichever you pick it up, all of them are the same. In fact, what you need to focus is the amount of toothpaste. Okay, you need to make sure that you don't fill the toothpaste from one end to another end. Okay, all that you need is just a pea-sized. That's a little bit small, which is one part of it. Okay, and the common mistakes people do is they put it under the water and they try to wet it and do all that. No, you're supposed to do basic things like start cleaning your teeth with that. Automatically, there is the soaping agent which gives you the froth. And if you brush in a proper technique, in fact, all of you can look up the techniques online for that. We call it this method of modified Bas technique. Okay, the modified Bas technique tells you that you need to brush from up to down on a 45-degree angle, not only on the tooth, but also on the tooth as well as the gums. And if you do that for 2 to 3 minutes on all the quadrants, okay, it doesn't really matter, as long as you're changing your toothbrush automatically once in 2 to 3 months. Okay, this is basic oral hygiene instructions which we tell. Unfortunately, the market is flooded with so many confusing, ideas. So that's why I think questions would have come.
When I was in the UK, this electric toothbrush became a big phenomenon.
Yes.
And then suddenly people started saying that if you brush with an electric toothbrush, one day all your teeth will fall down because the vibration, the level is so high that the gums will become weak and the teeth will start falling and all such things. So as you say, rather than trusting marketing gimmicks and watching advertisements, how to do it is more important than with what you're doing it with. I think that's
absolutely.
Yeah, I think unfortunately all the other students who have questions, you can write back. You can just send me the questions. I'm sure Dr. Denzy would be happy to answer. Yeah. Unfortunately, we don't have time for more than this. I request Princey ma'am, Andrea ma'am, please take over.
So I think before quickly wrapping up the session, I was just going to give a small instruction to all the students. Remember how we started off the session today, right? All of us with a big smile. And I think I request all of you again, quickly switch on your cameras and let's, come together and take a pledge, okay? That we shall be better informed, okay? We shall be more aware and we shall be more conscious of our decision, okay? So I'll just take a quick minute and request everybody to put on their videos. Okay. And like I said, a simple curve on your face. Okay. They say the smile is the only curve which sets everything straight. Okay. Whatever situation you are in and whatever thing you might be facing, it's always good to smile. Okay. It lightens up your mood. And remember, there are people behind these smiles. Okay. And there are people working for that to make sure that they give you that kind of appearance and working continuously. So if you are considering taking up dentistry as a profession, you now know that what all it comes with. Okay, like I said, you can always ask me about career options. You can ask me colleges and counseling. I didn't want it to be a counseling session. I hope I've given a little bit of idea for all of you, thinking points, because all of you are automatically very well informed. It's just that you need to look up and find out and break a lot of myths in the society which are there, and come together and contribute in the nation building process. Thank you so much, everyone at Charan's. I think I would really love to visit your institute once everything settles down. And thank you, Dr. Vinay sir, and everybody. Thank you, Vinita ma'am, for connecting us and for making this happen, and all the amazing students out there. Right, like I said, in a world where you can be anything, you be yourself. Right, that's all my take home message for everybody today is. Thank you so much. Thank you, sir.
Thank you, sir, for your patience to answer all the questions. Gratitude is the powerful catalyst for happiness. Now I call upon Harshit from 2C to convey out of thanks.
Good evening to all. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion on behalf of Charan's group of educational institutions. On behalf of Charan's group of educational institutions, I would like to thank our chief guest, Dr. Denzy Lawrence, who honored this event with his inspirational thoughts, who, despite his busy schedule, has found time to grace this occasion. I would like to thank our beloved principal, Dr. Vinay Ranganathan, who gave us this wonderful opportunity, staff members and volunteers who gave their valuable contribution, guidance, and encouragement in all our efforts, and the students and our beloved audience for making this event a grand success. Once again, I thank everyone present here. Thank you.
Thank you
Thank
very
you, ma'am.
much.
Thank you so much.
Thank
It
you.
was really
Thank you,
sweet.
Dr. Denzy. Thank you, Vinita ma'am. And thank you to all the lecturers, staff, and the students who arranged this wonderful program. And I hope that we get some dentists out of this session. And I'll be proud to say that Dr. Denzy's seminar has inspired students, as sir said, not only to take up careers in dentistry, but to take up something in which you're passionate about. That is what matters the most at the end of the day. Thank you very much. Have a nice day. Thank you and bye-bye.
Thank you, sir. Thank you. Thank you. Thank you so much.
Thank you, sir.
Okay, bye-bye, everyone. It was so nice to meet and interact with all of you. So we all see you very soon, right? Thank you so much. And like I said, it is in times of such crisis, okay? The COVID situation brings out really amazing things in each of us, okay? So take this as an opportunity. In adversity lies opportunity, right? So all of you, all the very best. Stay home, continue the process of learning, and enjoy the beautiful gift that is life. Thank you.
Thank you, sir. Thank you, sir.